Hi everyone, welcome back to my channel. To those who are new, my name is Dora and I'm a pharmacy student. I'm back with another day in the life of a pharmacist student vlog. I go to Ferris State University, College of Pharmacy, and I'm finishing up school with clinicals or rotations at Mercy Health Hospital with the Strive program. This is a longitudinal program where you complete all your rotations with one hospital instead of being at different hospitals, pharmacies, or offices to complete each 6-week rotation. Right now, I am on my ambulatory care rotation. Ambulatory care focuses on managing patients in an outpatient setting. The pharmacist has appointments with patients to address any concerns or questions, adjust medication plans based on patient-specific factors such as side effects, lab values, and treatment goals. The most common disease state that is managed in ambulatory care is type 2 diabetes mellitus, but we also see patients who are anticoagulated and patients with chronic migraines, dyslipidemia, hypertension, obesity, osteoporosis, and osteopenia. What I do each day depends on which clinic or office I'm scheduled at. I've been to about 6 different clinics with the pharmacist. On most days, I'm with the pharmacist and we follow up with patients. On other days, I complete CMRs or comprehensive medication reviews with patients, or do INR point of care testing for patients taking warfarin at the anticoagulation clinic. AmCare pharmacists receive interesting drug information questions from other healthcare providers and patients themselves. These would always be fun to look up and help the pharmacist with. I have looked up insurance formularies for medication coverage a few times before as well. I am on my last week of this rotation, and this rotation was a challenge for me. I started this rotation without really knowing what an ambulatory care pharmacist does. This rotation was also very clinical. I had to apply the information I learned in classes from previous years and create a care plan for a patient. Each patient is unique and has different comorbidities, side effects, lab values, lifestyles, and different financial circumstances. All of these factors play a role in selecting a course of action for the patient. Therefore, I had to make a connection between what the guidelines are saying and what the patient is saying and create the best care plan for them. This rotation was definitely out of my comfort zone, but I gained a lot of experience and confidence by talking to patients, pharmacists, and even other providers. Most of the time, being outside of your comfort zone will help you build your confidence and lead to your growth. Even though it may feel scary, just trust the process and it will be worth it. All the pharmacists I worked with throughout the clinics were so intelligent and shared with me their knowledge and also their tips and tricks. They also gave me feedback on a daily basis of the great things I did so I would continue to do them, and also the things that I needed improvement on. I know feedback can be hard to receive, but if you can listen to your feedback and work on it, you're on the path to greatness. Here's my setup. I use an extra monitor that I can hook up to the laptop with so that I have two screens to work with. I don't have to flip between windows and it makes working so much more efficient. I highly recommend it. I like to work up patients for the next day so that I can be more engaged with the pharmacist. During the later weeks of the rotation, I get to lead the visit with the patient, so looking at their chart and coming up with different care plans for them is important. There are specific things I make a note of when I work up a patient, and I use a SOAP note to help me make notes. First, I look for the reason for the visit, such as a diabetes follow-up or maybe an opioid taper. I look to see how old the patient is, along with their gender and race. Then I look to see what problems they have and what medications they're on. I always look for the pharmacist note from the last visit to get an idea of how the patient was doing then and see the care plan given to the patient at that time. After working up the patient, I like to come up with some considerations or possible plans so that I can talk it through with the pharmacist beforehand. I created an Excel sheet that I use when working up or discussing patients. It has drug charts, treatment algorithms, blood sugar and blood pressure recording templates, and immunization schedules. I organize them into disease states such as diabetes, high cholesterol, high blood pressure, COPD, asthma, and immunizations. They are basically notes that I can refer back to until I don't need them anymore. I don't think I would have survived this rotation without this resource. Besides working up patients, I have presentations for journal club, topic discussion, and a patient case presentation that I prep and practice for. This week, I did not have a presentation, so my agenda was lighter today. After I work out and work up patients, I take it easy. Most of the time, I would have a presentation to get ready for and would be finished around 8 to 9 p.m. I have finished my presentations for this rotation, so now I get more time to relax. After I shower, I like to make my room cozy by lighting up a candle and pulling down the blinds. Then I go out into the living room, water my plants, tidy up the kitchen, put the dishes away, do the dishes, pack my lunch, and then make a snack. Today I'm gonna wait for my parents to have dinner, so I just made some rice. I like to watch K-dramas or anime. Right now, I'm watching It's Okay to Not Be Okay, and it's so good. I just finished the remake of Fruits Basket and cried every single episode, and I'm waiting for My Hero Academia to put out more episodes. I also like to read mangas. This one I'm reading right now is called Lucia, and I'm reading it on s2manga.com. It's a free website, so I'm all about that, and I do recommend them. My parents come home from work and we cook dinner and eat together. Personally, I get lazy making food for myself, but I love to cook meals if I'm not eating alone. Food tastes better when you eat it with other people. After dinner, I brush my teeth and pick out tomorrow's outfit. I set an alarm in the morning, depending on the schedule, and knock out. Thank you for watching my video, and thank you for liking and commenting on my previous day in the life vlogs. I greatly appreciate it. Thank you.